Hello and welcome to HealthTech Hour on UK Health Radio. My name is Steve Roost, and each week we bring you the best news, views and interviews with the leaders, clinicians and CEOs who are shaping the health tech revolution in the UK and beyond. I'm a founder and CEO of a health tech company myself, and I'm passionate about the people and companies who are changing the world. Before I introduce today's guest, I'd like to remind everyone listening to follow us on the socials. It's at HealthTech Hour, and please follow the station, which is at UK Health Radio, to stay on top of all of the great content that's coming up. Today's guest, Dr. Kate Bunyan, is the Chief Clinical Innovation Officer for Dr Care Anywhere, which is one of the UK's leading digital health providers. It offers a range of services such as virtual GP appointments and digital prescription services. In the last 12 months alone, they've seen nearly a 400% increase in their virtual GP service, and Dr Care Anywhere is available to over 2 million people in the UK just through its strategic relationships with AXA, HCA and Nuffield. They recently IPO'd and have prioritized the launch of a mental health service to complement their physical health services. Kate herself has been a qualified doctor for her entire career and brings a wealth of medical and commercial expertise to Dr Care Anywhere, including a stint as a ship's doctor on a cruise liner, which I'm sure has a few stories there, probably. So as a founder of a health tech company myself, Dr Care Anywhere really are a UK health tech success story, someone that I personally look up to. And following on from last week's show with Dr Nick Taylor from Unmind, I'm really excited to hear about how Dr Care Anywhere are blending the provision of mental and physical care together. So Kate, welcome to the show. How are you?
I'm very well, Steve. Thanks very much for having me.
Good to have you on. I ask everyone at the moment, I know everything's kind of unlocking slowly, but how has the mood been in the camp at Dr Care Anywhere over the last kind of period of time?
I think the mood is optimistic. I think, as I'm sure we'll talk about in more detail coming up, we have been busy and busy takes its toll. Busy in lockdown, I think, has been difficult for a lot of people. Being away from your colleagues, being based from home, juggling so many things. But we've put lots in place as an organisation to try and promote the team, promote the culture in the group. And so being able to start opening up the office again, start encouraging people to come back together, I think is really starting to lift people's spirits. So I think optimistic.
Good. And are you finding that people are wanting to come back into the office? Is that socialisation aspect is important?
Definitely. So we're seeing a mixed bag in terms of the way people might want to use the office, but definitely that people want the opportunity to be able to come back to be together, to physically work together and sort of bounce the ideas around, collaborate, and do the things that you just find so much more difficult when you've got to plan a meeting and book it in with people, as we're all doing when we're doing it through Zoom. But definitely not a big desire for everybody to be back every day in the office. So I think, like many companies, we're going to see a real shift into flexible use of office space and flexible working from home.
Yeah, I think that I would agree, and it makes a lot of sense. So the show itself is in three parts, as regular listeners will know. So the first part is origins. How you came to be doing all of the amazing things that you're doing, both yourself and also Dr Care Anywhere. Then the middle bit is around all of the incredible stuff that Dr Care Anywhere is doing. And then the final piece is around what does the future hold, both for you and also potentially we can kick around a few kind of topics of the day. So let's start with how did you start out on your journey in life after university? So what was your kind of first start career-wise?
So my career, when I look back, I can see the thread that weaves my career together. Looking forward for each of the jobs that I took, it all feels a little bit like I just took the opportunities coming. But I had a very traditional upbringing, if you like, through medicine. I finished my medical degree. I went straight into my house jobs. I did the standard medicine and surgery house jobs. And then I decided I wanted to be a surgeon. So I went and did some time in A&E and then moved into doing surgical training. And as part of that, I started doing a lot more work in pre-hospital medicine, so exploring trauma, particularly focused around motorsports, which has been a lifelong passion for me. Right. So I started getting involved in that kind of thing. And then the light dawned and I decided that surgery probably wasn't the career for me, but probably emergency medicine was. So I moved out into emergency medicine, did some time in anaesthetics and intensive care to round out my skills around that critical illness piece. And then just life events coincided and I decided it was an opportunity to do something a bit different. And so I ran away to sea. I ran away, I joined cruise ships. and had a hugely enjoyable time working on board ships, traveling all the different oceans of the world, working in some amazing places and seeing some phenomenal sights. And on a different show, we might have a whole host of stories that we could share. But
yeah, I mean, yeah, it's before the watershed, so I don't want to go I don't want to go too far into it. But when you were a junior doctor, to the point around your thread, when you were a junior doctor, what did you foresee your path being like? Presumably, junior doctor was the bit where you talked about where you did your rotations and things like that.
That's right. My looking forward was going to be very traditional. I envisaged that I would go through training, I would become a consultant in something, and I would settle down and do what every other good junior doctor does and just tread the path. But
okay.
I was really fortunate to have an opportunity to step out of that. And that really opened my eyes as to just how versatile a medical degree is, just what you can get involved in, how broad medicine is, just how many different opportunities there are to get involved with, taking the core skill that I wanted to use, helping people. And actually making a difference to people. And along the way, in doing some stuff around event medicine and other areas, I started to really get a love of being able to take medicine and medical care to where people are at.
Okay.
And I think that's where I start to see the thread joined together with event medicine, then working on board cruise ships, treating people when they're on holiday or when they're working in a different environment. And then I moved from that back into work back shoreside, and became medical director for Carnegie UK, so P&O Cunard. And again, developing more of that track around medical leadership, but also about how you give great care to people where people need it, rather than expecting people to fall into line and take care from where we've organised it. The more looking forward, very much it was going to be the standard route. Looking back, less standard maybe.
Yeah, exactly. So when you with the cruise ship opportunity, which seems to be somewhat of a not turning point might not be the wrong word, but sort of a decision point, really. What had you known anyone that had trodden that path before? Or did you just literally just take a flyer and you thought, why not, sort of thing?
Yeah, I saw the advert for the job in the career pages of the BMJ. There was an open day going to be hosted on Queen Mary 2, an amazing ship. On the
QE2?
On the QM2,
wow.
Yeah, largest ocean liner in the world. And it was in Southampton. It was on a Saturday. I didn't need to tell anybody. I didn't need the day off work. I went down to see what it was about, and I was hooked.
Right.
The nature of the facilities on board, the type of work I could get involved in, the environment, the life, it came along at the right time for me, and it was a great opportunity that I decided it was worth taking. So I went for it.
And were you serving on the QE2 or serving on different liners?
So I served on Queen Mary 2 for a few contracts. I did a lot of transatlantic and world voyages on there, and then served on a variety of other ships as well, some down in Australia.
Oh, amazing.
I'm working around the South Pacific. I've worked in Alaska, Caribbean, around the Pacific out to Hawaii, Mexico, you name it, and I've been lucky enough to go there probably. So
that's incredible.
Very exciting times.
What are the main challenges or the main differences that people might not necessarily be aware of being a doctor on a ship versus being a doctor shoreside? What are the biggest things that you kind of took from it?
The isolation. So
okay.
Both in terms of the clinical conduct, so you're a small team. Even on my biggest ships, there would be 5 of us, 2 doctors, 3 or 4 nurses. And even though you may hear about people being evacuated from ships on a helicopter, you can only do that if you have enough fuel to get a helicopter from wherever it's based to the ship and back again. So there's only a small amount of land around the world.
Oh, there we go.
That you can. There's only a small amount of land that you can actually take a helicopter from. So most of the time, if you're in the middle of the ocean, it's what you've got around you, and it's your team around you looking after patients who have whatever is going to happen to them, their heart attack, their stroke, whatever is going to happens on board ships.
Wow. I mean, what an amazing experience. And I know that after that, you moved from being the doctor into being the medical director. So, and that then sort of charted a path slightly for some of the more, I guess, commercial facing positions. So just for my benefit, because I don't really know, but also for the benefit of the listeners, what is that transition like from being highly qualified senior doctor versus a medical director?
It was a really interesting transition for me. As you say, it was a move into a commercial environment. So whereas many medical director roles will be within a healthcare environment, so you still feel like you are part of that medical infrastructure, if you like. For me, it was very distinct that I was the doctor in the organisation, and so needed to take a very much more pragmatic approach and come to understand the commerciality, come to understand the financial implications of decision making, and understand risk management across a broader sphere than just the patients in front of you. So talking about budgets with people and comparing the importance of putting that budget behind fire suppression work in an engine room versus installing an electronic health record, and actually needing to understand the relative risks of both, and that broader impact that it's not just medicine that affects people's lives, and that you have to take it in the totality. And I think that stood me in great stead to go back into the NHS at a clinical director level, being able to think through the implications of the system on the decisions that you make. So you're thinking not only of the patients in front of you directly, or the patients that might use your service, but also those that are yet to be in your service, and how you might need to frame your thinking and your commercial approach to being able to give people better access across the piece and manage that financial aspect in a way that perhaps is broader than many doctors will have had experience of.
So would you, based on that, would you be a proponent of doctors, senior medics moving in and out of the NHS to gain more experience of both sides, to be sort of more holistic in their capabilities?
Absolutely. And I think one of the other things that's increasingly clear is there's loads of different ways of doing it within the NHS as well. So part of it is that you may not need to go outside the NHS to still get a really different experience from the one you've had. But I think doctors who are interested in, and clinicians of any kind who are interested in leadership, moving around the different parts of the system, seeing it from different angles, understanding different pressures, is really important for getting that well-rounded approach, and really helps to augment the way you then make decisions thereafter. Yeah,
I know that now, well, I think I'm not exactly sure when it started, but I think within the last 5 or 10 years, the NHS has been really focused on driving clinical entrepreneurship. So there's the Clinical Entrepreneur Scheme, there's the NIA, which is the NHS Accelerator, there's the Digital Accelerator that PokTalk's on. Was any of that around during that time for you? And if it wasn't, would that have been something that you would have wanted to do? Would that have been a valid pathway for you or not?
I think it's a brilliant pathway, and I think it's a fantastic set of opportunities now for people coming through the system. It wasn't really there when I was coming through, and I guess also I took quite an early route out of the NHS when I went and worked within the cruise industry. So at that time in my early career, I was probably doing something quite different already. But I think for those who are very keen to work out how do they make a difference in the system in a different way, being able to access those kinds of opportunities, the fellowships that are available, is hugely valuable. And you're right, the NHS is really trying to promote gaining, developing and encouraging, fostering, incubating those skill sets that are a bit different to the norm that you would acquire when you're developing in your particular clinical pathways.
Yeah, I think it's really what you mentioned, which is there's an acceptance that there are so many problems that need to be solved, and that the more aware you are and the more capable you are of solving them beyond your very specific skill set, the more valuable you may be to the organization as a whole, but the more fulfilled you as an individual may become. And I wonder whether, particularly a result of the pandemic, where key workers have been under the cosh for so long, that actually having an ability to do something slightly different might be actually even more attractive now. I don't know.
I think that's a really valuable point. And I think we were seeing it before the pandemic with clinicians, not just doctors, but nurses, physios, other practitioners, looking to develop more portfolio careers where they do get the opportunity to do the hands-on care that they loved and that they went into originally, but also the opportunity to expand and use different skills and work more cross-functionally and build multidisciplinary teams that can set out to solve problems. And I think it's so exciting. And hopefully that as we've come through the pandemic, we've seen the fruits of some of that, as people really have risen to the challenge, tried different things, looked at how they can take a problem, pull it to pieces using different people's skill sets and put it back together in a way that was sustainable. And hopefully that will promote and encourage people to adopt a similar route and make it easier for people to have portfolio approaches so they can do a bit of something and a whole lot of other stuff as well alongside it.
Yeah, I know that our clinical advisors talk about, they like to talk about how there's been more innovation in the last 12 to 18 months than there has been in, really more the last 12 months than there had been in, 5 to 10 years previously certainly within primary care anyway.
Absolutely. Yeah, I think the innovation and the breadth of that innovation has been staggering.
Yeah. Okay, so I know that Dr. Care Anywhere is very focused, obviously, on virtual GP appointments. Telehealth is also another way of putting it. When did you personally, professionally, first interact with virtual GP appointments, the telehealth concept? When did you first become aware of that within your professional career?
So working on board the cruise ships was my first taste of telehealth. So within the cruise industry, our need to be able to get high level support from people when you've got a patient that you just don't know what to do with meant that we already had a telephone system in place for seeking advice and consultation with people. But if you broaden that out to other parts of the maritime sector where they won't even have a doctor on board, that need for being able to get remote medical advice has been well documented for a long time. So I think knowing that telemedicine, telehealth has been out there, that's been going on for decades now. Okay. But it's transitioned into what we now see it to being that video, that on demand, that much more publicly accessible. We'd already started seeing that growth prior to the pandemic, but there's no doubt that the pandemic has really accelerated for people their willingness to interact with healthcare in that way, that desire to have that approach that is perhaps a little bit more consumer-led. We're very used to Netflix, we're very used to being able to be fed the sort of things we want to watch, the sort of lifestyle we want to lead through the apps, through Amazon, through Netflix, through our interactions with banking. We're very used to wanting it when we want it, how we want it, where we want it. And I think we've seen through the pandemic that people have recognised that you can get access to healthcare in the same way through companies like Dr. Care Anywhere. Okay, and on that note, how would you, for anyone not familiar with it, how would you describe Dr. Care Anywhere and what the services are that you offer? So we're very much a healthcare company that's powered by great technology. So we are a clinical services delivery of virtual primary care, so GP appointments through both video and telephone. But one of the significant things that we've done is start to tie up primary care with secondary care through diagnostics. So patients that have access to our services are able to get diagnostics ordered through their GPs and then have those diagnostics reviewed by a specialist virtually. And through that, we are able to make a primary care management plan for them, making sure that every touch point for the patient adds value to the patient, not just value into the system. A lot of the time that we see through the healthcare system, you have appointments for things where you come away knowing that you've now got to have another appointment, but the appointment itself didn't necessarily add much to what you understood about your particular problem or what you needed to do. So adding real value to patients at every touch point is something that we feel so important. So joining up that primary and secondary care, bringing them both closer to the patient, that's really where we're taking the direction of digital healthcare rather than just a pure virtual general practice model. Okay, and so primary care, I think everyone probably quite familiar with that. That's GP services. How would you define secondary care for anyone that's not completely familiar with that term? So I would describe it as the specialist services. So it's the services that you would ordinarily go to a hospital for, seeing consultants who are specialists. We talk sometimes about tertiary care as well, being that super specialist area where you might need to go to a central regional unit for some very specialised care. But if you think about what you might go to a local, what used to be called a district general hospital, so your local town hospital, that would be secondary care. And so we're linking together that community-based GP practice type care with that hospital-based care and linking it together to ensure that patients can get the information they need that they might ordinarily get out of secondary care, but actually pull that closer to them more into primary care than they may have experienced before. Okay, and how does that transition work? So I think that's really interesting, and that is a complete innovation on what was previously a very static, I meant more in general for the industry, which was more have a GP appointment over your phone or over your tablet. That GP, like you say, may prescribe something, or they may say, actually, you need a referral to somebody else.
but you may end up leaving that appointment with more work to do and not necessarily an answer to your solution. But what it sounds like there is that you've kind of joined it up. So how does that sort of work in reality? Could you walk us through a particular, example potentially?
Yeah, so perhaps you'd have a patient that might have back pain, and they will have an appointment with one of our GPs, and their symptoms will be gone through. They'll look for any particular worrying signs, what we might call red flags. And as long as there's none of that, then we would direct patients directly into imaging. So we'll organise for them to go to an imaging centre near them. If there is some particular bloods that are needed, we've got protocols that have been written together with specialists in the field, so spinal surgeons in the case of a back pain, as well as primary care doctors. So those images, any blood tests can be organised straight away. So the patient is going from their virtual general practice appointment into a diagnostic centre to have their imaging, have their blood tests done. And then those images and the results are coming straight back to us. We're then sending them in the cloud to a specialist. So in this case, a spinal surgeon in the cloud, who will review all those results and write a management plan. And if we take the average back pain person, they may well have a journey that would ordinarily say you go to your GP, you're then referred to an orthopaedic surgeon. You see your orthopaedic surgeon, they say you need to have an MRI scan. You go and have an MRI scan, you go back to your orthopaedic surgeon, and they say, yeah, there's nothing I need to operate on. Go back to your GP, they might want to consider physio. What we're doing is cutting out those bits of noise to say that actually what the GP can then sit you down with in your second virtual general practice appointment is to say, we've reviewed your imaging, the consultant specialist has reviewed this, their advice, their management plan is that we should refer you into physio. So now the referral you get is straight into physio, straight into the activity that's actually going to add value to you.
And that makes total sense to me. I mean, that sounds like a significant improvement on, and there's we've had a few people on the show, different areas, like rare diseases and certain kind of things like PCOS, where there's that same sort of pattern of repeated referrals to try and track down what the problem is, and people get shunted around, and it's sort of an average of 7 appointments and things like that. But that sounds like a massive improvement, and presumably it sounds like that's done in partnership or integration with the NHS. That's not a private operation, or is it private?
So it is. So we're incredibly lucky that most of our end users are people who will have an insurance package that includes our services, or their employers will have purchased our package. And for our insured customers, then they have access to this service. So it's all entirely managed off the NHS through private providers that we're able to have contracts with. So we can make that a really slick journey, and every touch point adds value. That improves the experience for the patient, but there's no getting away. It also has an economic benefit. So whichever system you put it in, if you have needless touch points, it costs more. So by improving this, we can demonstrate that we can make 20% savings on the cost of your average journey by being able to improve it in this way.
Right. I think it makes total sense. Have you had any, have there been any kind of obstacles to rolling that out? Because I know that sometimes, particularly within healthcare, things that seem obvious and make a lot of sense sometimes don't necessarily, get implemented for various reasons that you may not necessarily realize until you start to do it. So have there been any of those kind of things involved in that?
Our biggest challenge came from COVID-19. So we launched the service. The service had always been planned to be launched in April of last year, and the timing coincided exactly with the NHS very rightly needing to utilise private services to augment the services it was using to deal with COVID-19. So that availability of a private network of diagnostic providers, that availability of specialists to be able to review the services was more limited. So we took it a bit more gently, the implementation and the roadmap. And we're really lucky that we're now starting to see things open up. So as the rest of the country starts to get back on its feet again, we're also seeing private providers being able to make more capacity available into the private system, and through that being able to increase the number of people that we're able to put through these journeys.
Great. So if you wouldn't mind, would you mind kind of walking us through how a person can sign up to your services, then what happens, and how what's the kind of, there's probably not one average user journey, but how would you describe someone's experience from the minute they, so to speak, walk up to your door to the point where they end up using your services?
So we try to make our services as available and accessible to as many people as we can. So the platform's available on web-based, but it's also iOS and Android-based, so you can use it on phone, tablet, or desktop computer. As I said at the beginning, we use video and telephone. So if people aren't so comfortable with video, then they can use it as a telephone consultation. Okay. But we have seen a real shift in the last 12 months from people moving much more towards video. I think as everyone's got used to being able to do meetings through video, we've all become a little bit more comfortable with that.
I would think so. I mean, it's been a sea change, you know, there's no, I mean, I was saying to someone the other day, my wife had a baby in November, and you know, he's been on God knows how many Zoom calls, which before the pandemic was a big no-no. I mean, that would just never, you would not have that. That would be a big kind of faux pas in a business meeting, to have a little baby kind of perched on your lap. But now it doesn't matter, you know, which I think is a good thing.
Yeah, absolutely. And you're right that sea change behavior we're absolutely seeing embedding in the way people interact with our service. So you can come up to our front door through any of those medium, web, Android or iOS, and then you can book your appointment with your GP direct from there. So you sign up to our service through either a subscription, which you can pay for. You can join that through the website, or because you'll have been given a code through your insurer or through your employer that gives you access. And then once you're registered, you'll be encouraged to verify your identity. So it's really important that we know you are who you are, and that we know who we're talking to, because we're creating a healthcare record. And we're really proud of the fact that we share nearly 90% of our records with people's GP, but that's done with consent. So people who have an interaction with us will be asked to consent for their information to go back to their GP, so that the GP has a copy of that in the master record. So it really joins up their healthcare experience. And
is that integrated with their EMIS system or their EMR?
Yeah, so we're able to integrate through some of the NHS platforms to be able to send documentation through automatically if the practice on the other end is signed up to the same.
That's fantastic. So that was one of the questions I had, which was like, you know, if someone uses you, is there a duplication and things go missing? But no, it's all synced up.
Yeah, we think that's really important for good quality care and for safe care, to join things up as much as we can. So we're also really lucky that we're able to work with the NHS to get access to the patient's record, and that's a piece of work that's going on at the moment, so that we'll be able to do a lookup of that information at the time of consultation, as well as being able to send information back to the GP.
Oh, awesome.
That visibility, that transparency runs through everything that we want to do with our patients.
That would be amazing. So the GP will be able to effectively, you know, in real time search for your record prior or during the appointment, so they might have your records right there and then.
Yeah, absolutely.
Wow, that would be amazing.
Yeah, so we think that's a really key enabler of good quality, safe, effective care. So a patient will verify with us so that we do get that fluidity around the system, assuming that the patient's happy to consent for that. And then they can just book an appointment whenever they want. So you can go onto the platform, you can then request an appointment at a given time. You can choose your time, you can choose the doctor that you might want to see, or whether you want to see a male doctor or a female doctor by preference, or just who's the next available. And we normally have appointments available within a few hours of people looking it up. And we have appointments throughout the day and into the night. So we have the availability of the platform 24/7.
Wow.
So once a patient has then booked their appointments, they'll get an email to remind them that they've booked it and to confirm that they've booked. They may be asked to provide some additional information. So we have a team of triage practitioners. So you'll be asked as part of your booking journey is to give some information about why you want your appointment. And so, for example, you've said you've got a rash you want to talk about, then one of our triage practitioners may send you a text to say, could you upload a photo into your account? So the account is where all your information is stored. And again, we think that's really important, that you have transparency and visibility of everything that we know about you. Yep. So your clinical record is totally open for you to be able to see. You can see what information you're sharing, the administration side of that, but you can also see the notes from your GP. So when you have your appointment, you'll have a reminder text to say, come on in, your appointment's in 10 minutes. You have the opportunity to check that your technology is working properly. And then the GP will join you in a virtual consultation room where you're able to see and speak directly with the GP if you've chosen to do it by video, and obviously just hear them if you're doing it by telephone. The GP can then take you through all the things that GP would normally do, but where we really think we add value is that our GP appointments are about 20 minutes long. So we have a really long period of time to get to know our patients, to understand exactly what their problem is, hear the concerns, really work out what's the best thing for them to do. And there's something hugely beneficial about just having the time to be heard. And that's a lot of the positive feedback we get from patients, that they do feel that they've been listened to by the GP, that they've understood the problem, and therefore the solution feels like it's a much closer fit than perhaps they've experienced before.
Because 20 minutes, is that roughly twice what is sort of allocated for an NHS sort of face-to-face appointment?
Yeah, so often in the NHS, it's about 7 minutes at the moment. So you're looking at nearly 3 times the length.
Yeah. And was that something that Dr. Care Anyway has always done? Is that always something that was done from the beginning as a kind of like you said, a sort of a mission, if you like, to give people that much more time to talk about their issues?
We've always wanted to give people time to talk about their issues. We used to offer 15-minute appointments, and we decided that 20-minute appointments was really important to get that quality of experience and the quality of the documentation that ought to go with it, so that when a patient leaves that appointment, they can also look at their notes and they'll understand exactly what went on in that consultation. They will see the same notes that the GP has written that are in the back end. So it's totally transparent.
I think that's fascinating. Because slightly tangentially, that's one of the reasons why we started PokTalk, which is, we're offering the ability for people to give themselves blood tests and do risk assessments on their cardiovascular health and diabetes health just with an app on their smartphone and one of our tests. And the reason why we did that was because one of the reasons we were quite focused on the idea that people should be able to see their own data, their own biological data, their own health data, and have access to that when they wanted it. Whereas what sometimes happens, within the NHS and things like that, is that you go in and you might have a blood test done, but you wouldn't necessarily even see those results or a copy of them. You might just get said, oh, they're fine, or oh, something's elevated, but you don't have that. You don't have access to it on an ongoing basis. So I completely understand why you've done that with the medical records. I think that's really, really smart, actually.
Thank you. And we think it's really valuable for patients to have both, to make sure that they have access to all the information. It's their information. It's about them. It's their health. It's their health. It's for them to work out what good looks like.
Yeah.
But team that up with the right information to understand it. So we've probably all had blood tests where something has been flagged by the laboratory system as being abnormal, but it might only be a smidgen out. And a doctor will look at it and go, oh, they're fine. And you're left with that dissonance around, but it's flagged as red, so surely it's not fine. Yeah. The doctor knows from their experience that in the broad scheme of things, these are the reasons why the parameters can sometimes be a little bit out. There's a range of normal, but normal can still be outside there. Yep. But we shortcut that conversation. And I think it's so valuable for patients to be able to understand the facts around their information. And so you see it on your phone, your watches, all these different wearables that we now have. More data points, and increasingly the information to help you understand those data points in the context of you and your life and what you need to take away from it. Yeah, I completely agree. I think everything that data needs to be put in a context, and that is one of the real value points of avoiding giving people data just in and of itself, and having that data provided in a way which provides the context, provides some security and some advice, and actually some sort of direction thereafter, so that the person doesn't go back to Dr. Google and start, scaring themselves, right? Absolutely. Yeah, I think it's so important that people feel empowered, but it ought to be action orientated. So if you come to PokTalk and wanted a tests done, then you came for a reason. Let's make sure that they get that information and then they know what to do with it next. So that they feel that there's been an outcome to it that is useful to them, that helps them to optimize their health in the way that works for them, that is meaningful to them. I think it's so important. Medicine tends to be quite patriarchal, quite, the doctor knows best. We have a model of what good looks like, what fit and healthy looks like. But actually, we're all different. We all have different goals. We all have different challenges. And good looks different to each of us. And we should be allowed to be able to map our health in the same way. And I thought it was really interesting listening to your podcast last week with Dr. Nick from Unmind, thank you. Talking about the biopsychosocial model. Yes, that was a new word. That was a new word for me, but I loved it. It was a great word. And it's absolutely right. So the biopsychosocial model is not brand new, but the idea of being able to combine people's biology, so what's the physical side of things, with their psychology, their mind, their emotions, their mental well-being, with the social context, the setting in which that patient is, that person is, it's just so important. And I think when you walk through the steps of that, it's a bit of a no-brainer that, yeah, well, I am the product of all three of those things. And what we're really trying to do at DCA is to say, well, that is important, and we shouldn't keep trying to separate them. It is really important that health be seen in that spectrum, that it's all things around the physical, the emotional and the mental health, and the context for that individual, where they're sitting, what they want to achieve, what good looks like to them.
So let's talk about that. We can jump ahead. I think I've got too many questions for you because I find your business absolutely fascinating. So let's jump ahead, because I know that you made a big announcement around that concept, which is the integration, or producing a complementary service for both physical and mental well-being. So tell us about that, because that sounds really groundbreaking.
Yeah, we're really proud of the work that we're doing in this area, because everybody, again, it predates the pandemic. The fact that there's not enough resource to go around to help with mental illness. We know that there's so much that people can do for themselves to help prevent them get to a point where they feel unwell and disempowered by what's going on for them. But we also think it's really important to recognise how intertwined physical and mental health are. And we don't really have a great language for it. So we talk about mental health, and it's good to talk about mental health. And there's an assumption around physical health, but almost by separating them out into those two things, we're further defining that they are separate.
Yeah.
But if you think about, if we take our person with back pain again, let's imagine that it's a gentleman who's been working in the city for years, and they're developing back pain, but when they go home, their back pain is so bad that they don't feel that they can sleep in the same bedroom as their wife anymore, because they're tossing and turning. So they're now sleeping in the spare room. It's not so comfortable. Their marriage is suffering because of it. They can't connect in the way that they were. So what may be a physical problem, the back pain, is absolutely causing an impact on their emotional well-being and the social context you need to understand if you're going to tackle getting that person back to what needs to be right for them. Because they may not totally solve the back pain problem, but if the goal is to get back into bed with your wife, then actually that's a really achievable goal, and you can work through to deliver that very differently when you understand that that's the goal.
Yeah.
You often hear people talk about, I just want to be able to pick up my grandkids.
Yeah. Yeah.
If that's your goal, let's work to that. Let's not work to, I want to be pain free.
Yeah. So the goal itself, because I think this is what we talked about with Nick last week, which was really, I thought was a really interesting way of phrasing it, was that there's a lot of outcomes that aren't diagnostic outcomes in a traditional medical sense, which is exactly what you just said, which is like my idea of a good outcome is being able to pick up my grandson, granddaughter. Yes. That's really different to some medical diagnostic version of whatever that person's problem might be. Absolutely.
So with the work that we're doing at DCA, we are bringing in more tools that can help people to support themselves and their emotional well-being. And we've teamed up with Koa Health to implement and integrate their Foundations app into our system.
Okay.
We've teamed up with Kooth, you've also spoken with before. So we've put their Quell platform into ours for adults, so that you've got that peer community support around your mental health and your emotional well-being. And then we've improved our training for our GP workforce, and also provided them the opportunity for a longer consultation, so a 40 minutes.
Yeah, I was going to ask. Sorry, go on.
So after you've had your 20-minute consultation, the doctor may identify that you'd benefit from even more time talking to a GP. And the real focus around that is to further explore the context and the mental health history, but also to start setting some goals, so understanding what's important to you. And significantly for us in all of this is, this is not something that is there for people who simply wish to say, I think I have a mental health problem. We're saying if you've got a health problem, approaching all these different facets can really add value and improve your time to healing. And by having these different components available to people, we feel they can move in and out of self-support, primary health guided support, and of course we can still refer into secondary care. We can refer directly into therapy. We can augment people's care journeys by making it easier for them to understand what they need and when they need it. And by teaming up with these different providers, we can bring that all into one space. And we're really excited about what might be coming down track. But we're looking forward to being able to also add digital therapy into our platform as a solution that we'll be able to provide.
Okay, for digital mental health therapy or digital physical therapy. Okay.
Digital mental health therapy to begin with, but also moving into digital physical therapy as well. Again, recognizing that parity is needed in both sides.
Makes sense. And so obviously there's a range of different digital mental health platforms, providers, companies. How did you go about sort of filtering all of the possibilities down to what you ultimately chose to do? Because each one of them has a slightly different approach, a slightly different philosophy, slightly different focus. How did you work through all of that to figure out your direction?
So I think our due diligence process helps us to look at understanding the basis for people's care delivery. So when we're thinking about the mental health space, looking at what the scientific evidence that a particular tool has, understanding the basis for the claims being made and being able to demonstrate that they are legitimate. It is a really new field, digital therapeutics. And so expecting everybody to have randomized controlled trials, which might be the gold standard in care, is probably a little early. But are the providers seeking to head in that direction? Are the claims they're making ones that they can provide evidence to support? Or are they based off assumptions of sort of general knowledge? Is there something sitting a bit more behind it? Looking for values of the partners, do they also believe in the biopsychosocial model? Do they think that that whole person approach to health is important? Because that values match needs to really fit. And ultimately, is this a journey that a person coming in through Dr. Care Anywhere still feels that they're receiving that same level of care, that same level of knowledge and empowerment, whatever different part of the service that they might be accessing, so that it doesn't feel jarring? Because we're very aware that the system is fragmented. It is really difficult to know what you should go for. So what we feel is good for patients and good for people who are exploring their health is to feel like they feel grounded. They feel that they can trust us to have built a network around them, to put the resources around them that prevent them needing to go to Dr. Google. They can come to us and they can trust that what they get through us is consistent and is applicable and is of high quality and well governed.
That makes sense. I think that makes total sense. And has there been, I know we've talked about the pandemic sort of more in general terms, but what was the impact on your delivery of services during that period? And have you seen a change or an increase in demand for those sort of more mental health related services from your offering as a result?
Yeah, I mean, we saw a dramatic increase in the number of consultations that we were serving through last year, as I think everybody who was working in digital healthcare did, as people were trying to work out where they could access the care they needed. And we did a lot of work with our partners to help people understand that they do have access to the service. So at times when the NHS was really under the cosh, as you described earlier, that people knew that there were other avenues that they could explore that did not take away from the value that the NHS brings. So we weren't wishing to describe or make anybody feel that the NHS wasn't there for them, but that perhaps we could help to augment that service for them. So we saw huge growth. And in that, we saw a real change in the way people were using our service, particularly. If we recognise that a lot of our service users come from an insured background, so oftentimes the way we were initially set up, we would be looking at patients who were essentially looking for referrals into secondary care. But what we saw through the pandemic was a much greater use of the service for primary care purposes, so coming to us as the sole need for their care, so for more prescriptions, for their chronic care management. And in that, we saw a lot more anxiety related. So even if people weren't coming to the platform describing symptoms of anxiety, of unhappiness, we identified their physical health symptoms were also really intertwined with that picture of the difficulty they were experiencing through their journey through lockdown and through the pandemic more broadly. So talking to people more about grief, about loss, be that about physical loved ones, be that about their jobs, their status, so many other reasons. So they might have presented because they're feeling run down, but that conversation quickly moves into that more mental health space. So really honing in on that importance of you don't need to know why you're not well. You just need to know you don't feel right. And you need to know where you can go to get the tools to help you get back on track with where you want to be. And so we're seeing that uptick in people wanting that kind of service and finding that they can get that through DCA.
And that and the clinicians, I'm guessing, but I don't know, are they fairly in favor of that because it means they have more time to spend with patients, to talk to them and to do what they love or what they're trained to do. Would that be fair?
Yeah, very much so. So we're incredibly lucky. We have a great workforce of clinicians that work with us. And the vast majority of them will work in the NHS as well. So they'll be part-time with us and part-time in the NHS. And what we tend to find is that they enjoy the time they have with us because they get to practice the skills that they're really well trained for with slightly less time pressure, with a slightly different group of people with different resources at their disposal. And that gives them a huge boost that they can then take back into the work that they do within their NHS practice. So they feel that virtuous benefit of working in a different setting, and it gives them the boost to go back. Also, when we're looking at things like the training that we put in for our mental health program, we get lots of reports from our GPs that they're then taking what they've learned through us and applying that in all the consultations they do, whether they are deliberately with us or whether they're back in the NHS, and being able to think about the context, think about the social setting for patients. And it's stuff that they've been long trained in. As I said, this isn't anything new, but sometimes you just need a bit of a refresher. You just need an opportunity to be reminded of why it's so great and why it is so useful for patients. And the time that the GPs have being able to use that with us means that when they then go back into their NHS practice, even if it is shorter appointments, they can still find ways of making use of those skills and being able to bring that to life in any patient that they see. And I think that's really important, and it's really rewarding for us as a company massively, to be able to support clinicians in that way.
I can imagine. So on that kind of note, how do you express or talk about the value that DCA, the Dr. Care Anywhere, brings to patients or users as well as clinicians? Do you have some way of sort of expressing that, or any metrics that you look at that you can share?
So this year we have implemented our patients report card and our clinicians report card. So we feel that measuring how people feel about the services that we provide and about the services that they are delivering as clinicians is really important. So we're very excited to have been able to put together a dashboard and to put together metrics. It's early days in our use of it. We've been looking at metrics with regard to patients for a long time. We have an NPS score of greater than 80. We have high scores on the app stores, with great reports and reviews on Trustpilot. But we wanted to take that deeper and actually understand what is it that they love about what they're getting from us. And that's where our report cards come in. So not just being able to give ourselves a pat on the back, but always striving to work out how can we do better, challenging ourselves to understand more deeply, and then being able to make sure we're delivering that both for people who use our service on the consumer end of things, our patients, but also on those who are delivering it, and make sure that our clinicians know that we really care about their opinions and that they are well set up to deliver an amazing service for us.
And have you come across anything surprising, any positive but surprising feedback of things or features or aspects that people loved or were extremely positive about, which you hadn't necessarily thought would be so popular or so, would get so much positivity? I
think less so about that we were surprised by, more that it was really useful to have that validation. And two of the biggest areas are access, the ease of access to being able to use the platform, the ease of being able to deliver a service through our platform and the way our technology is built, and speed of access. And that both of those things come over really clearly, that people do want to move to this model where they can get their healthcare when they want it, in the way they want it, and get the right care first time. And I think there's a lot of information and sort of a lot of people putting together, read white papers and talking about access is changing, the consumerization of healthcare. And I think those are all really valid points. But when you have it validated by your own group of people who are able to say, those things matter to us, then it really brings home that it's an important journey that we're on.
Well, I know that there's people who access your services via a company plan, but even those people have chosen to come to you and opt in and sign up for that service as part of that plan. But particularly anyone that comes up directly, they've chosen to work with you. They've chosen you to deliver their care, which is a huge, it's hugely positive.
Yeah, absolutely. And we have more than 2 million people who have access to our services through our partners, of which about 500,000 of them have activated their account, so they are fully signed up and ready to go and have an appointment. And we know that the vast majority of them will go on to have an appointment within a few weeks of signing up to the platform. And once they've used the platform, we know they'll come back and use it again. And that's a big shift through the pandemic, that desire to use us as their first stop and only stop for their primary healthcare needs. And as we can expand that into secondary health, it's just going to add so much value to people.
Do you think that there's any, have you heard anyone say that, oh, I'm choosing to use Dr. Care Anywhere because I feel like that means it means I'm no longer a burden to the actual NHS?
Very much so. So especially during the first lockdown, that was a lot of the messaging we were hearing from patients, that they were grateful there was a service because they didn't want to burden the NHS, but that they were worried and they were able to be relieved of their healthcare worries by talking through with somebody. And I think we'll all learn so much out of the pandemic, but being able to give people accurate information, the right information at the right time, there won't always need to be with a consultation with a doctor, but being able to make sure that quality information, trusted resources are available for people so that they don't sit and worry, but act when it's necessary and act early are really key things that I think we've learned. We knew before the pandemic has really reinforced that.
Yeah, I would agree with that. So as chief of clinical innovation, which is a great title, what are some of the innovations that you've either seen within Dr. Care Anywhere or outside of Dr. Care Anywhere in the last sort of 12 months where you've been particularly impressed by the innovation?
So I think there's so many pockets of fantastic innovation going on. There's some great new apps, there are some great new resources, ones that are looking at how you can put remote monitoring into the hands of a patient. So how can we actually help to keep people out of hospital? When I think about my clinical practice and how much just needed a measurement of this or just needed that. And there's a lot that you can do virtually, but there's so much more you can do if you just have access to a few more metrics. And I think the innovations that are making those truly scalable and easily interoperable, those are really key phrases I would look for in innovation at the moment in this space, so that you can integrate them into our platforms, into other platforms, so that information flow moves confidently and securely around, so that the clinician can then make decisions based on accurate and up-to-date information, but not just in terms of the consultation, but blood pressures or weight or height. That kind of information adds so much value, but you're then seeing the opportunity to have stethoscopes that patients can have in their homes and transmit information, that you can teach a patient how to do some of these interventions that would ordinarily have been only the remit of a trained clinician. Blood taking that you can do at home painlessly, easily, and confident that the results are meaningful. I think those are the innovations that I'm really interested in seeing as they come out to the fore, and then how you can build those into good programs of care, rather than just being seen as a gimmick of something that you can do and have, but doesn't necessarily add value into your wider journey. And then I think from a DCA perspective, I think where we're going with understanding the importance of bringing healthcare closer to the patient, both physically, but also thinking about self-care and peer support as really key enablers of good health and of helping to drive patients to a place where they feel much more empowered to manage their health their way, and then surround that with great clinical, well-governed services. I think that clarity that we're getting as we bring this together to move away from just general practice consultations, that transactional, acute, reactive services into proactive, preventative services, I think that's a whole other conversation that we can
I mean, with that, I mean, that's why we started PokTalk, was we felt like by allowing and making it easier for people to monitor their own blood values and have their risk assessed of these various cardiovascular disease and diabetes, and then be connected with follow-on care directly using that data, that you would be able to prevent more people or lower the risk associated with those things. So coming in that prevention piece and understanding about how and when you come in and what you need to do to make that person or encourage that person to change their behavior, I think is going to be absolutely critical.
Yeah, absolutely. It just doesn't make any sense to not bring the care earlier on in the journey, help people to live their best life from early on in, and that means understanding the behaviours that drive that, understanding how you can influence people, how you can give them the information that helps them make what's the right decision for them, what's the consequences of it. And I think that's a really exciting place to be able to take digital health so that we can actually make some really significant inroads into how we can change the healthcare systems.
Yeah, I think prevention is really the sort of the next big, frontier on some of this stuff as to how we bring a lot of that care more earlier. And the NHS has done a huge amount of work, obviously, with the NHS health checks and a whole bunch of other things. But, it's going to be really exciting because there's so many digital health or, innovative health platforms, companies out there that are focused on that same thing in various different ways. So, yeah, I think the next, 2 to 5 years is going to be pretty fascinating in that area.
Yeah, definitely. And again, tying it back into what we're doing with our platform, our data being transparent to patients. If you bring that preventative health data in as well, people can see the impact what they're doing is having. When we can get to the point where we can identify people as starting to go a little bit off track by some tiny changes in their wearable data or in the way that they're shopping, for example, and bring that in a way that we can then highlight to them. It looks like you're having a bad day. You've just bought 3 chocolate bars today. That's where we can get really personal with healthcare, interact really early on and make some significant changes. I think it's a really exciting field to be in.
And so is Dr. Care Anywhere, is your aim to combine the clinical expertise that you've already built up with more of the broader healthcare, sort of someone interacting with Dr. Care Anywhere for their whole health ecosystem?
Absolutely. Yeah, that's where we're heading, bringing the whole thing closer to the patient through our forum as a means to be able to come to DCA and get all your 360 care, everything that you need in the one place, trusted.
Cool. Great. Well, look, on that note, Kate, thank you so much for coming on the show. I think your business is fantastic and I'm so excited to see what's going to come up for you guys in the next 12 to 24 months. So I really appreciate you coming on the show. And thank you to everyone for listening.
Thank you.